In this series of videos, we will see ascites. Ascites is an easy diagnosis with the point-of-care ultrasound. Small amounts of fluid can be detected. Here we see the right upper quadrant and we see the following structures: the kidney, the liver, the hepatorenal space, which is full of fluid or with fluid that is anechoic, and then we can see prehepatic ascites. If you're going to perform a paracentesis, do not do it at this place unless you are experienced. As you can see, there is ascites also in between the hepatorenal space. This is the right lower quadrant, and here we can see fluid. There is a good amount of fluid, which is anechoic. Then we can see a bowel loop. Bowel loop has peristalsis, and this is normal to be observed. This is another video that contains ascites of the left upper quadrant. The difference here is that there is no fluid in between the splenorenal space. The kidney is there. The spleen is abnormal. The splenorenal recess is closed. Usually, if you find fluid in the splenorenal recess, you need to think about spleen bleeding. And then there is ascites. This is the left lower quadrant, and you can see ascites. The momentum is going back and forth, and you can also see reverberation artifact, which is common when you are evaluating cavities that are full of fluid. These are artifacts and not structures. Here we have another left lower quadrant with fluid, as you can see, the anechoic part. And then we can see bowel loops. The bowel loops are coming in and out of our field of vision. We see a right lower quadrant, and you can see fluid. If you follow the scale that is to the right of the screen, you can see that there are at least 5 centimeters of clearance. This could be a good place to place a catheter and take a sample. Then again, we can see bowel loops. You can see also that the wall of the bowel loops is swollen. This is a case of a patient who had malignant ascites. This is a subcostal view, and we see the heart in a 4-chamber view. You can see the fluid right in front of the heart, which is giving us the window. The fluid is anechoic. The falciform ligament of the liver is right there. And then we can see the same patient after paracentesis. Now you see the liver coming in and out. You can see a lot less fluid. And again, you see the heart in a 4-chamber, subcostal 4-chamber view.